Oh, he's a very good father. He worked 2 jobs. It was like during the Second World War when I was growing up.
Mom was a great adventurer. She was fearless. Just admire that spirit so much, and I see it in our children, and I know that it's carrying through the generations. I'm so proud of her.
She was very active, social. She taught many of the cello players in Springfield. She taught cello at MSU, taught to many local students, was very involved with PTA, loved her family, was a wonderful wife and mother and grandmother.
Oh, well, she was a stay-at-home mom. She took care of the house. She took care of everything.
A super husband. Matter of fact, because my jobs always required me to travel, maybe any place between 30 and 45% of the time, he really was kind of the mom. Parenting is really his thing. A solid provider, just a lovable guy.
I was a freshman in high school, and I worked at trying to get him to ask me out for the entire school year. He was a senior. No, I liked him my freshman year. It was the sophomore year he finally did. The last 2 weeks of his senior year. Yeah, I know, you're the one with Alzheimer's.
His boss had called me to say, had I noticed anything different about Dave?
We noticed some small things, but we kind of wrote that off to getting older.
We noticed a difference when Gene started using those stories as tapes, and they were totally out of context with what we were talking about at the present. In other words, she started basically living in her tapes because it was very difficult for her to talk.
He'd gone off the road and the highway patrolman had found him, and he was disoriented, and the highway patrolman said, you might have something going on here that you're not aware of.
Jim was diagnosed with Alzheimer's, early onset Alzheimer's, 3 years ago. 3 years ago this last month.
It is absolutely an awful disease.
Awful.
It is awful.
I hate it, and I'm afraid of it.
I'm scared of it. It scares me of losing my best friend in the whole world.
And when you see them this way, it's devastating.
It affects everybody that you come in contact with, and especially the family.
Todd was pretty much in denial about what was happening to his mom, and that was really hurtful for him, and it was hurtful for me, and I also got a little angry.
He cared for her so deeply, and to the point where he lost his life. He went through so much stress and strain, and even though the siblings were there to help out, and the children were there to help out, it took his toll on Dad, and he lost his life in 2005.
He was living in Florida with my sister at the time, and she refused, once she found out, she refused to send him to a home or anything, and so she took care of him for the last 8 years, and she did all that 24/7 care that you're supposed to get. Wouldn't let anybody else touch him, basically. So she's my hero.
Because now he wanders, the grandkids, they're always kind of looking to see where he is and what he's doing. And the 8-year-old granddaughter, she's the one that does the most with him in terms of, I'm getting ready to do my math work, Grandpa Dave, and do you know what 8 plus 5 is? And if he gives the right answer, she says, great job. But it always is from the standpoint that she's helping him as opposed to him helping her. So that's her contribution. And she understands about the disease. She understands that his memory fails him. And a couple times I think her feelings were hurt because he couldn't remember her name.
It's very hard on the children, but it's also very hard on the grandchildren and the great-grandchildren because they remember Grammy, their beloved Grammy, just very smiling, loving woman, and they'd go visit her and she couldn't communicate with them. She didn't even recognize them.
It consumes your life. It is the hardest thing I've ever done. We've raised 5 girls, and it's far harder than that. Because with children, you can see the progress they're going to make and you can help them in the direction they need to go. But with the Alzheimer's, it's all downhill.
What I used them for was just to listen and to just have them tell me that, yeah, kind of, you know, you're on the right track, and just give me permission to feel as I was feeling.
Even if you just need someone to talk to, they always have a listening ear.
They have the information you don't know you need yet.
You need all the help you can get. You need all the communication skills. And the Alzheimer's Association gave us those skills.
It's not a one-man show. I mean, you need support to actually handle an Alzheimer's patient.
I can't imagine going through someone with this disease and not having this resource.
Good to have people that you can rely on to help get you through stuff like a bout of depression or other, you know, forms of things that get your mind.
I cannot put a worth on what these people do or how they help our families.
But it's like a lifesaver to a drowning person.
Patty said to me, all I can tell you, it's time. And someday you will remember Jean as she was. You won't remember these hard things that Todd and I are sitting here and starting to get tearful about. And you know what? That's what happened.
One of the funny things is when we first got the diagnosis, we woke up one morning, we were laying in bed, we were just talking, and he rolls over to me and he says, "Who are you?" I said, "That's not funny."